WFNZ.
Live from Studio A at the Cumulus Broadcast House, it's Health View with your host, Dr. Angela Ruff. Your information leader for more than 65 years. News Talk 640.
WFNZ.
And welcome to Health View. This is Dr. Angela Ruff, and our guest this morning is Dr. Kenneth Rich, who is a native of Buffalo, New York, graduated with a B.S. in psychology with a distinction from the University of Michigan, Ann Arbor, and went on to earn his M.D. from the State University of New York at Buffalo. He did both his internship in general surgery and his residency in neurosurgery at the University of Kentucky Medical Center in Lexington, becoming board certified in neurosurgery in 1989. He practiced with Johnson Neurological Clinic in High Point before opening his solo practice in Raleigh. In 1989, he joined with Dr. Garner to form Capital Neurosurgery, Inc. Dr. Rich is a member of the American Association of Neurological Surgeons, the Congress of Neurological Surgeons, the Southern Neurological Society, the North Carolina Industrial Commission Liaison Committee, the North Carolina Medical Society, the Wake County Medical Society, and the Think First Foundation of Wake County. Well, Dr. Rich, thank you for joining us this morning, but after reading that bio, how do you wear all those hats?
Well, fortunately, each one of them does not come with a hat of its own.
They kind of interlap, huh?
Yes, my hair would dye.
I hear you. Now, I was reading. I know your practice was recently featured in the MD News magazine, in a really nice article. But maybe if you wouldn't mind, and you know, the general listening audience may not understand exactly what is it that your specialty does in neurosurgeon. Do you mind expanding a little bit on that? Sure.
Of course, we're surgeons. That's part of the term neurosurgeon. So we do operations on people. Most patients come to my office afraid that I'm going to rush them right to an operating room and operate on them. And that's not true. Actually, the minority of patients who come to our office as new patients get operated on. We see a lot of patients, and sometimes we're seeing them to reassure them and the family doctor that sent them or the chiropractor that sent them that they do not need an operation. Uh-huh. Sometimes people aren't sure if they need one or not, and we may discuss surgery with them as an option, but they opt not to have surgery. But we are a surgical subspecialty that operates on the brain and the spinal cord and the nerves in your arms and legs, like your sciatic nerve or your funny bone, if you will. Mm-hmm. But most patients don't get operated on, so we practice in the field of treating nerve disorders that might be surgical or might not, and help people make decisions about what they should do about those. So just because somebody's referred to you, that doesn't necessarily mean they're going to destined to have surgery. No, actually, it's quite the opposite. Dr. Garner and I have both worked very hard to establish a reputation for being very conservative with the knife, so to speak. Mm-hmm. And, most patients who come in, we'll counsel them, we'll talk to them, and most new patients that come to our office do not get operated on. Mm-hmm. Yeah, I thought that was interesting. I was reading in the article where you talked about a lot of the brain spinal injuries. A lot of times, I may be misquoting, but a lot of times these injuries can kind of heal themselves in a few weeks' time, or... Well, I assume you're talking about things like ruptured discs and so forth, and actually the majority of ruptured discs are going to be treated non-surgically. Probably about 3 out of 4 ruptured discs in the neck, which pinch on a nerve and might cause neck, shoulder, and arm pain, and about 3 out of 5 ruptured discs in the low back, which would cause back, buttock, and leg pain or sciatica. Those are roughly the numbers who will not get operated on. So the majority of people with a ruptured disc, if you give them a fair chance, proper non-surgical care, use medicines, use physical therapy, chiropractic, injections. Most of those patients will get better without surgery.
That's great.
It's great for them.
Yeah.
I like doing surgery, actually.
Well, it's nice to know that there are neurosurgeons in the community that you can refer to, but will, not necessarily do the surgery if there's a chance they can be healed with other means.
Well, that's the only fair way to treat their problem. I've had a ruptured disc in my low back, and it did not get operated on. Mm-hmm. So I firmly believe in trying non-surgical methods first. Mm-hmm. It doesn't work for everybody, but you got to give people a fair chance to avoid an operation. Humans don't like being operated on.
Right. I had a similar thing where I slipped in the shower and had ruptured my lower disc, and I couldn't move my leg, and I just knew I was going to have surgery. But it was in about a month and a half to 2 months. The pain finally stopped. So it was nice for it to be healed without having to do that.
Yes, it is, and we think there's a lot of good theory. It's very hard to prove, but a lot of good theory that if you can just wait long enough, that operating on discs and not operating on discs has the same eventual outcome. I'm talking 5 years and 10 years down the road. Sometimes I'll joke with patients as I explain this to them, and I'm giving my age away here. I refer to the Gilligan's Island medical treatment plan.
Ooh, that's my error.
Well, mine too, except you have to be younger than I am.
Do I sound younger?
But, on Gilligan's Island, they didn't have a doctor, they didn't have a pharmacy, they didn't have a physical therapist or a chiropractor, and there's no treatment. But I'll guarantee you, if I could have plunked you with your ruptured disc on Gilligan's Island, and then we came back and rescued you 5 or 10 years later, probably with the same success rate as surgery, your pain would have gone away. The question is not will it eventually go away, but can you afford the altered lifestyle that the pain forces upon you while you try to let it go away? And that's where things sometimes fail in patients who can't sleep at night, who are taking too much medicine, who are missing work, and things like that. They opt for surgery because they know it might get better if they wait. They know it probably will get better if they wait, but they can't afford to wait any longer. Right.
I tell you, I fell in love with that TENS unit.
Well, whatever works for you.
That was helpful.
TENS units help this person, and chiropractors help that person, and medicines help another person. None of us has all the answers.
Right.
But if we just try to use whatever time we have, however long the patient can endure the pain or the disrupted lifestyle, if we try to use that time intelligently and try all these different things and realize that when we all work together, you get the best result for the patient, then that's going to maximize the number of people who get better without surgery. Right.
I have some patients come to my office, and they have, it's just, amazing how many narcotics they're on because of their back problems. And I truthfully, I have great respect for the pain they're going through, since I went through that little episode, and mine only lasted for maybe 2 months, And boy, some of these people, they are having to kind of live with it. Maybe I should have given her your card.
Well, please do. I'll send you some.
There you go, yeah.
I have seen patients who have been treated excessively with pain medicine, and they've been on narcotics for a year. You know that they're addicted,
right?
And they have a problem you could have fixed, or you could fix, but now you have another problem. You have to treat the addiction. So there's a fine line to walk. You don't want to operate too early, but you sure don't want to drag things out so that people become addicted, or they lose their job, or it disrupts their family so much that they have internal strife in their family. You sort of want to walk a line, and that takes a lot of talking to patients. Right.
So, I was interested. I think both you and your partner are part of this Think First Foundation. Do you mind just sharing with the listening audience about what's involved with that?
Well, Dr. Garner, my partner, is much more actively involved in that. He was one of the earlier people to get involved in Think First over a decade ago. Think First is a nationwide movement by neurosurgeons, and now we've included other physicians like pediatricians and so forth. But it was started by neurosurgeons to try to prevent head and neck injuries to children. Anything from wearing seat belts when we're talking to teenagers driving,
right,
to wearing helmets when we're talking to children who are riding bicycles. And each little community, for example, here in Raleigh, Dr. Garner had a wonderful movie made about preventing people who are in a motor vehicle accident, in a car accident, from hurting their spinal cords while they're being moved out of the car. And that was with the help of Rex Hospital. They financed it and they produced a very educational but very watchable movie that you could show to teenagers who might be involved in an accident about what not to do, trying to help their friends maybe get out of the car. You could make a neck injury a lot worse.
Right.
Other places might talk to grade school children about wearing their bicycle helmets and try to encourage that, or get a fundraiser going to buy helmets for children who can't afford them. So across the country there are a bunch of different little projects going on, all designed at trying to help children avoid brain and spine injuries, spinal cord injuries.
I know when I was in college, I had saved up for this coat, and so finally got the thing off layaway. And I think it was like maybe the first week I had this thing on, and sure enough, a drunk driver hits our car, and I'm the passenger, and so they had to get the EMS to come to cut the car open to get me out of it. I think I was more upset not as much with my facial injuries, but they had to cut my coat off to get me out with that board in the back. But
well, as
we
bad
were in
as that might have
college,
felt, you can get a new coat.
Yeah, it's like, not the coat, please, not the coat.
Well, our EMS people here in Raleigh and in Wake County, we're very blessed to have a very efficient and very well-trained EMS service that they will safely extract you from the vehicle, and they will put a hard collar on and put one of these real uncomfortable boards under you so your spine can't slip around and hurt your nerves and things. But they do a great job. Yeah,
well, coat or, be paralyzed. I think they probably chose the right choice there.
Yeah, like I said, it's easy to find a new coat.
Teenagers don't have any real brain cells, right?
Right. It's easy to find a new coat and hard to find a new spinal cord.
That's exactly right. So, anyways, that's what my dad pointed out to me, too, at the time. But we're in a moment we're going to take a quick break to hear from our sponsors. But when we get back, if you wouldn't mind, maybe we could talk a little bit more about some of the other preventive things that can be done to help people avoid spinal cord injuries. But then maybe you could get into some of the things you guys do for anterior cervical chronic neck pain and things like that.
Great.
Okay. So you are listening to Health View. And again, our guest this morning is Dr. Kenneth Rich, a neurosurgeon based in Raleigh, North Carolina, his office. And Dr. Rich, the phone number for your office, I don't think I have that down. What is y'all's number?
It is area code 919-850-9911.
9911. And do y'all have a website as well?
We do, but the last time Dr. Gardner and I looked at it, we've been practicing together almost 20 years.
Right.
we do need to update the picture.
I hear you. I know. I need to update mine as well.
I wish I was that young.
Well, but maybe I won't update my photographs. I'll keep people thinking I'm still that young. So if you have questions for Dr. Rich you'd like to ask him later, their office number is 919-850-9911. We're going to take a quick break to hear from our sponsors. Again, this is Dr. Angela Ruff. You're listening to Health View on News Talk 640 WFNC.